by our friends at Konica Minolta Marinette. And all right, I'm going. This is a presentation that you can get actionable information from to immediately integrate and impact your organization's compliance program. To the agenda, the core topics that we would be covering today. We'll start by taking a very quick look at the HIPAA final rule. This rule, as many of you may be aware, came about in early 2013, and pieces of this rule are going into effect as of September of this year, 2014, especially the piece that impacts business associates. And we'll talk more about the HIPAA final rule and business associates in a couple of minutes. Our core objective is to ensure that we summarize why the HIPAA final rule is so important and how it should impact your organization's compliance program for HIPAA and HITECH. We then will talk about the risk to organizations, that could be covered entities, and covered entities, as you may be familiar, could be any provider organization, any payer organization, clearinghouse. Providers could be like hospitals, health systems, clinics, physician practices, dental practices, pharmacies, laboratories, you name it. Payers could be insurance companies. And so the risk to organizations is there with respect to the cyber attacks that are taking place. And we will take a quick look at different types of threats that an organization may experience and what your compliance program for HIPAA and HITECH should be looking to address. We'll talk about the breaches that have been experienced by banks, retailers, as well as healthcare, so that we can learn from those experiences and use that knowledge to enrich in your organization's compliance and security program. I also want to talk to you about the cyber attack life cycle. What's the process typically that the cyber attackers take to compromise organizations, and we'll take a closer look at the anatomy of an attack. And all of this is really valuable information that we are hoping that you can take back into your organization and to help prepare. Really the first step in the journey for any entity is to put together an enterprise system security plan, because if you are audited by a federal agency like OCR, or you may be audited by CMS for meaningful use compliance, and the core objective, there is a core objective that relates to security risk analysis. One of the documents that is typically asked as a part of those HIPAA and meaningful use audits is, do you have an enterprise-wide security plan? And so we'll talk more about that, but that's something that you got to ensure is a plan that addresses the threats to your organization, the risk to your organization. That's one aspect of it. And the other piece of it is, how does your organization address the regulations like HIPAA privacy, HIPAA security, HITECH breach notification, HITECH meaningful use requirements. And so that's the third piece of our agenda today, talking about the compliance mandates, because you want to make sure that these core HIPAA and HITECH compliance mandates are continually addressed within the scope of your compliance program. And then we'll close the presentation today by talking about security controls. Every organization, regardless of size, needs to ensure it's got a rich combination, a blended set of security controls. And I'd like to walk you through some typical controls that we have experienced organizations implement from a best practice in healthcare perspective, so that we can all learn from those controls and you could potentially use that information as a checklist to see what controls you have implemented, what control deficiencies may exist within your organization to ensure that you are in fact prepared to address the types of attacks and risks that an organization may be vulnerable to. My name again, Ali Pabrai, and I am with EC First, home of the HIPAA Academy. And EC First has been delivering HIPAA solutions for training, for certification, consulting, policy development, and all that for over a decade. We are very excited to be partnering with our friends at Konica Minolta, and wanted to especially thank Rick and Lee and Joe, among many others, that have worked hard to bring this event to you. And we also wanted to acknowledge all of you members of Amerinet that we have tailored this presentation for. So as I mentioned, please keep those questions coming, and we will do our very best to address the questions that come up. So the final rule, as you are aware, was introduced in January 2013, so it's been around for about a couple of years. It has had an impact on almost all of the previous HIPAA regulations. So today, when we think of compliance with HIPAA and HITECH, we really need to think of and ask the question within our organization, are we continually complying with HIPAA privacy mandates? Are we continually complying with HIPAA security mandates? And that's the HIPAA security rule. Is our organization in compliance with HITECH breach notification requirements? And then for those of you that are on this webinar today that have participated in the HITECH Meaningful Use program, which is audited by CMS, the question becomes, have we met all of the stage 1 and stage 2 requirements of meaningful use? So when you look to compliance with HIPAA and HITECH, we are really talking about compliance with privacy, compliance with security, the enforcement rule, where the penalties are defined, and HITECH breach notification for unsecured PHI. Now, unsecured PHI, just that phrase, I wanted to take a few seconds to emphasize. Anytime you see that phrase, because that phrase comes directly out of the HITECH breach notification requirements, and that directly points to protected health information that may not be encrypted in your environment, because encryption, at least with respect to HIPAA and HITECH, provides a safe harbor. So one of the critical takeaways for all of you that are on this webinar today is to clearly identify where is it within my organization that I've got PHI across my servers, across the cloud, the data center, the end devices, mobile devices, all of that. Clearly identifying where does PHI reside. That's number one. And the concept of unsecured PHI really relates to where is that PHI not being encrypted. So you've obviously got protected health information that may be in storage, data at rest, but it may also be transmitted, data in motion, and you've got to clearly identify and document where is it that your PHI is not being encrypted. And the reason for that, as you can imagine, is that if you do have a breach, and as you've probably heard before, it's not a question of if your organization will experience a breach, it's when your organization experiences a breach, one of the first things you need to determine is, was the PHI that had been breached encrypted? And that's why this concept of unsecured PHI becomes very important, and we'll talk more about that in the coming slides. The areas impacted include business associates, so HIPAA impacts covered entities, and like I mentioned, your providers, your payers, your clearinghouses, all impacted. And the covered entities have responsibilities and are liable to ensure that, because it is the covered entity where all of the PHI originates, right? A patient walks into a hospital and now PHI is being generated. The hospital may decide to share that information with one or more business associates. The hospital is responsible and liable for ensuring that it's got, and these three words are the cornerstone of the HIPAA and HITECH regulation. Everything comes down to three words: reasonable and appropriate. So the hospital or the health system or the covered entity needs to ensure that it's got reasonable and appropriate capabilities to protect and secure that PHI wherever it may be stored, wherever it may be transmitted. Now, as a direct result of the final rule, there's the liability also rests with business associates. They could also be directly audited, and we expect business associates to be audited in 2015 by OCR. So who are your business associates? I think that becomes a key question that every organization should be looking to address, and to ensure that your business associate agreements, and again, we'll talk more about this, but your business associate agreements, every single one of them, has been updated to address the requirements of the final rule. Breach notification, you got to make sure you've got policies, procedures related to breach notification. The privacy rule has been impacted. You've got to make sure those policies and procedures have been updated, and then ensuring that the requirements are met. Covered entities, I've defined that already. Business associates. So when a covered entity like a hospital or a clinic shares information with a business associate, the key change that was introduced with the final rule is that not just contractors, but subcontractors and sub-subcontractors are also impacted by the final rule, and could see a penalty of up to $1.5 million per area of violation. The last bullet on this screen is important because there was a word that was introduced with the final rule, and that word is on the second line of the last bullet: maintain. So you may have business associates that you're working with that are maintaining protected health information on behalf of a CE, a covered entity, and those organizations also must be compliant with the HIPAA final rule requirements. The definition to the business associate has been updated, and so it's important that when you go back and take a look at your business associate agreements, that you clearly use and understand the updates that have been made to the definition, because you may need to send business associate agreements to additional organizations that you may not have sent it out to previously. And also very important to clearly identify who may be the subcontractors, subcontractors associated. And you really have to think about this as a business associate supply chain, because you, the covered entity, are ultimately responsible for where PHI that originated in your organization flows through these business associate contractors and subcontractors. And many of you that are on this webinar today, your business associates may very well be in the U.S. within the 50 states, but for some of you, you may have business associates in other countries, India, Philippines especially. We are seeing a lot of PHI from the U.S., from provider organizations, covered entities, being processed, being transmitted to other countries. And so that's a place where you've got to look very closely at to ensure that those business associates are not your weaklings. A question that I just saw that came up was, is this webinar being recorded? And yes, Lorna Wagner is in fact recording this webinar, and we will make it available for future reference, as well as some of the questions that I've seen relate to PowerPoint slides. We put together a terrific set of slides for this presentation. The team worked hard to prepare the slides, and we will make it available to all attendees of this event. The bottom line, and that's the takeaway for all of us with respect to the final rule and HIPAA compliance as it stands today, December 2nd, 2014, is that CEs, covered entities, must assess who is a business associate. So you should have an easily and readily available list of your business associates who process PHI, and make sure that you identify the business associates based on the new definition of business associates from the HIPAA final rule, and also take into account your cloud service providers. Many of you that are on the webinar today may already be using cloud providers. As you look to 2015, I would expect that information is only going to increase. We are moving increasingly to moving more information to the cloud. And I think the other thing that we are noticing in the industry, in the healthcare industry, there's more virtualization that's taking place. And so that's just the general trend, if you will, in healthcare information technology. Business associates must comply with technical, administrative, physical safeguard requirements. So for those of you that are experts on the HIPAA security rule, you understand, just like peeling an onion, the HIPAA security rule has administrative safeguards, physical safeguards, technical safeguards. The business associates must comply with all of those requirements, and business associates are liable for their subcontractors who may access PHI. Now, a key responsibility, and I cannot emphasize this enough, and the reason this is really, really important, and it's a very simple question that you have to ask yourself, and you have to ask your business associate, every one of your business associates, is when is the last time your organization conducted a comprehensive and thorough risk analysis activity? As many of you may be familiar, risk analysis is the #1 implementation specification in the HIPAA regulation. If you're audited, one of the first documents that's asked for is a copy of a risk analysis report. And you don't want to be producing a report that was done 8 years ago. So best practice in the industry is to conduct a risk analysis activity annually, and I would highly recommend that be very disciplined in conducting that exercise. So maybe the last couple of months of the year or the first couple of months of the year, you conduct the risk analysis activity, and then you take the rest of the year for remediation action, your corrective action plan, and then come back to it the following year. So it's a very disciplined approach, and then when you're audited, when they ask for you for your 2014 risk analysis report, your 2013 risk analysis report, that gives a lot of confidence to the auditors that you are taking this area of HIPAA compliance very seriously. And even if you're not able to remediate all of the findings that come out from the risk analysis report, it still gives a lot of confidence that there is significant effort being expended to ensure that the compliance requirements are taken seriously, and it is a priority for the covered entity as well as the business associate. So the covered entity, for those of you on this webinar today that are covered entities, must make sure that you get some type of an assurance back from the business associate that they themselves have conducted a risk analysis activity. And one of the things that I would encourage you to send an email to your contact at Konica Minolta, and I'll share his email address at the end of this event, my good friend Rick, is to ask him to share with you a copy of the checklist for business associates. The reason this checklist for business associates is important, this is something that you could include as an addendum and to your business associate contract and require the business associate to complete it annually. It's kind of like a self-attestation that they would do themselves, but they are required to push that out to you, so it doesn't take any additional effort on your part, because all of us know it's not like we're sitting around here with nothing to do. We're all busy, but you can put that burden on the business associate to complete and do a self-attestation where they submit that checklist for business associates form back to you. And that shows when you are audited as a covered entity that you have taken things to the next level. And that checklist document, Rick would be happy to share that with you, complimentary, no cost, at the conclusion of this event. So something to think about. Again, Ali Pabrai with EC First, very excited to be here with you today, and I hope you share in my excitement. Breach notification has been around for quite some time, and it was updated as a result of the final rule. They strengthened it. Certain changes were introduced. The harm standard that many of you may be familiar with, that was there with the interim requirement, was removed, and it was more risk-based. And these 4 points that you see on this slide that requires, per the final rule, with respect to breach notification, that a risk assessment must be conducted to determine the probability that PHI was compromised. So the nature and extent of the PHI involved, you've got to make sure you document that. The unauthorized person who may have gained access to that PHI, whether it was actually acquired or viewed, and the extent to which the risk to the PHI has been mitigated. Now, anytime, now this is an important point, anytime your organization experiences a breach, there are two critical things that you've got to do immediately. Number one, I would highly recommend that you create a process within your organization that is based on the breach notification form that is available on the Health and Human Services website. And all the questions that are on that form should be immediately responded and completed based on the information you have about the breach you may have experienced. So step one, complete that form so you have an accurate description as complete as possible about the breach. And number two is then do a risk assessment of the breach, where the risk assessment should cover those 4 points. And based on what your analysis is from those 4 points that you see on the screen, that's when you make a determination in terms of, do we need to take additional steps with respect to notification to the federal authorities, notification to the state authorities, etc., about this breach that the organization may have experienced. Now, moving on. So breach notification is a really important aspect, and the bottom line is to ensure that you've got policies and procedures developed to address this requirement. You also have to comply with the HIPAA privacy rule. The HIPAA privacy rule has been around since the early 2000s, and it has been updated, as you can see on this slide, with respect to the requirements introduced as a result of the final rule. And so you need to go back to your HIPAA privacy rule policies, your HIPAA privacy rule procedures, and make sure all of these areas are in fact updated. For example, those of you that are on this webinar today that work with hospitals, clinics, health systems, physician practices, doctor offices, dental offices, etc., notice of privacy practices must be updated because that has been impacted by the final rule. So you got to make sure that you go back to your privacy rule policies and update those. Now, I see a question that has come in, which is about, is FIPS a part of HIPAA? Is FIPS required to meet HIPAA? And I'll be talking more about FIPS in a few minutes, the Federal Information Processing Standard. So FIPS is not a part of HIPAA, but FIPS, certain documents related to FIPS do become very valuable references for HIPAA compliance. And really, when you think of FIPS, you should broaden that to think of NIST, National Institute of Standards and Technology, and think of FIPS as being a subset of the NIST document library. And NIST documents and standards are very valuable references for HIPAA compliance. And we'll talk more about that in a few minutes. Let's now switch gears we've taken a quick look at the core aspects of the final rule. And now we will talk about the different types of attacks that various industries have experienced because we see the same type of attacks beginning to take place in healthcare. Now, before I talk to you about some of the attacks that the banking industry experienced this year, a couple of statistics that I just wanted to share with you. Number one, and these statistics have come out from the Forrester report that I saw in the Wall Street Journal. Number one, 59% of mobile devices are encrypted. 59%. That's where things are today in the industry. 59% of mobile devices are encrypted. The reason I mention that is a question that you need to ask inside your own organization. If you are not encrypting, and I cannot emphasize this enough, if you are not encrypting 100% of mobile devices that come into contact with PHI, you are significantly increasing the risk to your organization from a HIPAA compliance perspective. So something, just food for thought, and a question for you to take back to your IT department or for you to take back to your executives and to review, are we encrypting 100% of our mobile devices? Because that's an area of significant risk, and we'll be talking about that. Now, another statistic that came out of Forrester report, 39% of security incidents relate to lost or stolen devices. So let me just repeat that. 39% of security incidents relate to lost or stolen devices. So these devices, your iPhones and iPads and Samsung, whatever, are going to be lost, are going to be stolen, and they do have PHI on it. And so the question that you need to ask is, how have you implemented mobile device security? And you need to ensure that you implement some type of mobile device management, some type of MDM solution besides all your policies and procedures to ensure that that does not increase the level of risk to your organization. Now, why is it that you and I are on this webinar today? And that's the third and the last statistic that I wanted to share with you, which also came out from that Forrester report. Healthcare records can fetch about $20 for a single record. So the going rate in the black market for healthcare records is about $20, and that increases to $500 for complete patient dossier. So $500 for a complete patient dossier. So that's the risk that that the world that we live in terms of these cyber attacks. Now, what can we learn from this Chase cyber attack? The attack started in June of 2014. So that's not too far back. The breach was detected as a result of a routine scan. Now, I want to draw everyone's attention to that second bullet. The breach was detected as a result of a routine scan. This is a really, really important point and a question for you to take back to your organization. Are you conducting routine vulnerability assessment scans? And what we see in the healthcare industry, the simple answer to that question is no. You need to make sure that your organization, you may be a very small physician practice or a very large system, is conducting these vulnerability assessment scans on a regular basis. Because without conducting these scans, you don't know if your organization is or has been compromised. And that's how they detected this with respect to Chase. The hackers compromised a flaw in the banking website, and because of that flaw, they were able to reach deep into the enterprise infrastructure. And so that's something that you've got to consider is the risk to your organization. If a portal, like a physician portal or a patient portal is compromised, can that compromise lead to access deep within your organization's infrastructure? If your wireless infrastructure is compromised, can they gain access to confidential, sensitive information? And what becomes even more complicated in today's environment is these attacks are routed through other countries, so it becomes very difficult to trace where is this original attack coming from. Like in the case of Chase, the attack was routed through Brazil, and it seems like they originated from from Russia, that layers of malware from Russia were installed on compromised systems. Now, the critical takeaway for all of us on this slide in healthcare is, what are the capabilities that you have to actively monitor critical systems? And I'll give you my 2 cents because we get a lot of we do a lot of HIPAA audits all the time across the country, and in general, organizations are just not doing a good job of active monitoring. We tend to react to breaches or incidents that may occur. Community health systems. And again, all of this information is public information. August 18th is when they announced a breach that impacted 4.5 million patients. And this breach occurred over a 90-day period from April to June. And it was detected in July. So that's another question that these bullets that you see on this slide are very important, because when you experience a breach and after you complete the risk assessment of that breach, if PHI was compromised, you've got to make sure that you're reporting that breach to federal and state authorities. And these are the type of pieces of information that you're going to be required to complete in that breach notification form. And a question that I would like all of you to think about and ask inside your organization: how long does it take your organization to discover a breach that you may be experiencing or may have experienced? In this case, the attacker used the Heartbleed vulnerability to retrieve content of a Juniper device, and this has been exploited by hackers, by the attackers, to gain access to valid user credentials, which they then use to access the internal network. And one of the areas that we see as an area of significant risk in the American healthcare industry across small practices, large organizations, is patch management. And you've got to really develop a policy for patch management that clearly articulates what will be your organization's position on patch management of operating system updates, application updates, all of these updates that must be performed, but typically organizations are lagging behind. And a system that is not patched on a timely basis is a vulnerability waiting to be exploited. So that's something that you've got to take into account. Now, slides will be available. I've again seen some questions come in about slides. Rick, my friend from Konica Minolta, will be making available slides for this presentation, and we've got invaluable information in this slide deck. We'll be making available these slides to all of the attendees after the event today, so not to worry about that. But I also encourage you to pester Rick and ask for various checklist documents that he keeps hidden, and one of which I've mentioned, is the checklist for business associates, that I would encourage you to look at that and see if that could be a part of an addendum that you introduce with your business associate contracts with organizations that you may be working with. Retailers, and we've seen a lot of this in the press, so I'm not going to spend more than 15, 20 seconds on this. Target, Home Depot, you name it, they've all been compromised. And the key thing here is that the data was not encrypted, and that was the data that was compromised. So a question that you need to ask is, first of all, where is it within my organization that I have PHI that may not be encrypted? And in the case of these retailers, the breach was deeper than previously reported. Almost always, typically, seems to be the case, and the hackers invaded the systems for several months. That is worrisome. And one of the questions you need to be thinking about is, if your system gets breached or you experience an incident, what capabilities, what security controls do you have to be able to discover those breaches on a timely basis? The attacks from China and Russia and Eastern Europe are not going away anywhere. We are going to see those type of attacks continue for months, if not years to come. And those attacks are going to get more sophisticated. They will be more persistent and will be more advanced. And that's the threat that we've got to recognize as a risk to our organization. And in the case of these attacks that originated from Unit 61398, very well documented, Wall Street Journal, New York Times, and other sources. But what's worrisome is that the hacker stayed inside the hacked networks for an average of about a year, 356 days, with the longest lasting over 1,700 days. And it's not like they were discovered after 1,700 days. They had nothing left to discover after 1,700 days. And so, that becomes something that we've got to be thinking about is, and a question that I'd like to, for you to take back to your organization is, how do you know that your infrastructure has not already been compromised? What tools, what security controls do you have in place to actively discover these attacks that may be taking place on your network infrastructure, which is why it becomes so important to conduct that risk analysis exercise on an annual basis and to conduct the vulnerability assessment and the vulnerability scans on a quarterly basis. Coke itself was compromised, and the reason I included this slide in here, most of the things that we've talked about are attacks taking place from the outside, but do not underestimate, and you are responsible for, the attacks that may take place from inside your organization. You may have a person in the IT department, and I apologize to all my CIO friends on this webinar today, but you could have someone in the IT department who isn't really happy and is looking to resign from the organization and wants to compromise some systems or some applications. And could that lead to a risk within your infrastructure? So not just threats from the outside, but risks to your infrastructure from the inside. Those should be a part of your risk analysis activity as well. And keep in mind, December 2nd, today, the world that we live in, this slide kind of gives you a sense of that these attackers, the hackers that are out there, really treat it as a life cycle. They will conduct an initial reconnaissance where they're trying to get metadata through Google and other sources about your organization. They're trying to get access to valid email addresses that they can use, establish a foothold within your organization, escalate their privileges, do internal reconnaissance. Now, when they do an internal reconnaissance, what they are trying very hard to get at are a couple of things. Number one, they want to compromise your Active Directory server. Now, think about it. Why would the cyber attacker want to compromise your Active Directory server? Well, because that's where your crown jewels for credentials are stored. And they'd love to gain access to more credentials on your environment. So the security of your Active Directory server becomes very critical. And number two, they're trying to gain access to intelligence, to information of value, like PHI, like social security numbers or credit debit card information and all of that. And so that's what they're doing. They're maintaining a presence, a process or an application running in the background, sniffing and seeing what traffic is coming in, going out of your systems and networks until they complete the mission, and continually they're leaking information out to other sources. There are lots of malware tools out there that are used to compromise systems and networks, and it almost always seems to start with some type of an email that looks very genuine and is a phishing attack that is used to get the user to click on some link that then installs malware on that system. So your malware protection capabilities are very, very important in your environment. So this slide is a special one that we've put together for the audience today, just to give you a sense of the fines that have been applied to date with respect to HIPAA. But more importantly, so we know, I think all of us recognize, you would agree with me, that a fine for HIPAA non-compliance is a seven-figure risk to the organization. I think that we can take for granted because those are the type of fines that we typically see coming back. The only thing that I will say from what we've seen in the healthcare industry and looking ahead to 2015, that we will see a lot more of these seven-figure fines in 2015. Now, what are the areas of risk associated that leads to these fines? And that's what I think you should pay attention to on these slides, is the information below the dollar number stated with these bars. Medical records left unattended and vulnerable. So that's a question you need to ask is, where do we have these medical records and how protected are they? Now, previously leased copier, so your copiers, your printers, your fax machines, all organizations have these multifunction devices, these MFDs, and is the information, when the lease ends and you return these copiers or printers or these fax machines, it's going back to your vendor, it goes back to another organization, what was the checklist that you performed on the device to ensure that there wasn't any confidential sensitive information? And so that's something that should be a part of your risk analysis activity as well, is to ensure that you conduct a thorough review of these devices in your environment to ensure that unencrypted information is not going to be in storage, because these devices do have significant storage capabilities and they are intelligent. They are connected to your network. Laptops, tablets, phones, iPhones, and Androids, these are going to be stolen, and that's again a risk to your organization. PHI discovered in public dumpsters, e-PHI that may be discovered through your portal sites that you may have implemented. All of these are areas that you've got to be looking very seriously at. Keep those questions coming. I'm seeing an increase in questions, and some of you are very actively engaged. You need to make sure, one of the comments that I'm seeing in the questions is that information is being transmitted from these multifunction devices, and you want to make sure that these multifunction devices do come with software that provides support for encryption capabilities. So when you're talking with vendors that you're acquiring these multifunction devices from, some key questions to ask is about encryption and other security software that these devices should be providing support for. Again, Ali Pabrai with EC First, very, very excited to be here with you today. I am supported today with Lorna Wagner from my team, as well as my friends at Konica Minolta, Rick and Lee, as well as Joe Cisner. And then we're very excited to bring this event to our friends at Amerinet, and a lot of good information. Keep those questions coming. Now, everything in information security and everything in HIPAA compliance comes down to three words: confidentiality, integrity, availability. And people in the security industry refer to it as CIA, confidentiality, integrity, availability. These three words appear in just about every page of the HIPAA security rule. So very central to the HIPAA regulation, and should be very central and core to the compliance program that you put in place. Three of the most important references that are out there that can influence your efforts to comply with the HIPAA regulation, the ISO 27000, PCI DSS, and NIST. And we'll talk more about these in a couple of minutes, because they, even if you decide not to adopt those as frameworks, they're still very valuable information that can influence your organization's efforts with HIPAA compliance. Now, for those of you on this webinar that are impacted by meaningful use, where you may have received funding, your physician practice, dental practice, your hospital or a health system receive funding for meaningful use, there is a core objective in stage 1 and in stage 2 that relates to meaningful use, and you want to make sure that you are meeting those requirements of meaningful use stage 1. And the biggest thing with meaningful use stage 1 as far as security is concerned is that you conduct a risk analysis exercise, and that should be conducted on an annual basis. With respect to meaningful use stage 2, because many of you may be at meaningful use stage 2, and that not only requires you to conduct a risk analysis activity, but also puts a lot of emphasis on encryption, security of data at rest. And so we talked earlier about these copiers and printers and other servers that may have storage devices. You got to make sure that you're looking at the appropriate encryption of all of that information with respect to data at rest. Now, the reason meaningful use is very important in terms of ensuring that you're complying with it is that it requires attestation some individual within your organization has to attest that they have met all of those core objective requirements. So risk analysis activity must be conducted, and you've got to be looking very closely at encryption across storage with respect to meaningful use stage 2. Now, one of the points I forgot to bring out earlier in my presentation is that when you report a breach, that breach notification also requires attestation. So we are seeing attestation, although it was not originally as a part of the HIPAA regulation, but we are seeing more and more of the newer enhancements, if you will, or the updates to the HIPAA regulation introduce attestation, definitely tied into meaningful use and definitely tied into breach notification. Moving on to the 3 important references. So a couple of takeaways from this webinar. 3 of the most important words in the HIPAA regulation: reasonable and appropriate. Now, when you are looking to define reasonable and appropriate, you have got to look at it in the context of the 3 pillars of information security: confidentiality, integrity, availability, right? So that's kind of the foundation, if you will, of the HIPAA regulation. You will find a wealth of information with 3 critical references that are out there. You're not required to use these, but I cannot recommend these enough. The first one being ISO 27000. Now, the reason ISO 27000 is so important is because those of you that are on this webinar today that are business associates outside the US, outside America, the Bible for information security is ISO 27000. So I know in the land of my birth, India, businesses there, everything in information security starts with ISO 27000. Philippines, a country where we've conducted a lot of security audits, a lot of HIPAA audits, again, everything starts with ISO 27000. And ISO 27000 is the world's most comprehensive information security framework. So terrific reference out there. The more familiar you can be with it, the more richer your HIPAA compliance program can be. This was updated in 2013, and you can see in the right column, we've highlighted a couple of items: cryptography, great reference for encryption and cryptography, as well as for supplier relationships. The supplier relationships, I found it to be a terrific reference for business associates. PCI DSS, for those of you that are on this webinar that process credit debit card information. So if your network infrastructure, if your applications process credit card information, debit card information, then chances are high you've got to comply with PCI DSS, Payment Card Industries Data Security Standard. Now this standard also, like ISO, was updated in 2013, so there's a newer version of this standard, version 3 is out there. And for those of you that are on this webinar that are impacted by PCI DSS, you know, and you can see it on this screen, that the risk assessment must be performed annually. Vulnerability assessments, those scans that I talked to you about, should be performed quarterly, and a comprehensive penetration testing should be done annually. So, you know, these might also influence the work that you may be doing with respect to risk analysis. NIST is another another reference that is very valuable, the National Institute of Standards and Technology, and they've put together a cybersecurity program that you can reference. It's out there in the public domain. They've established the key steps associated with it. The special publication NIST documents, especially special publication 800-30, is a terrific reference when you're looking to conduct a risk analysis activity. Every organization, every entity, all of you that are on this webinar today must be looking to conduct vulnerability assessments and penetration testing on a regular basis. You've got to look at it from the outside, so that would be external. That's how your cyber attackers kind of are looking how they can compromise the environment, but also from the inside, an individual in IT, for example, that may have malicious intent, a review of your firewall system. So that should be a part of your ongoing activity that you conduct within the scope of your risk analysis. Now, in this last segment of my presentation, I wanted to talk to you very quickly about security controls. We could spend a couple of hours on this, but I wanted to bring out some key areas for you to take back to your organization. One, very simply, put together a two-column table that identifies what are the security controls that you have implemented. So identify the vendor products that you may have deployed for firewall systems or intrusion detection or intrusion prevention, email encryption, secure texting, that kind of stuff, as well as the controls that may be missing in your environment. And that's important because when you have a breach, that's one of the things that you got to report to the federal authorities is what controls you had implemented and what controls you would be looking to implement to ensure that this breach does not occur again. I cannot emphasize firewall systems enough, and yet many of you that are on this webinar today, and I just speak from personal direct experience, we've really done a good job of deploying firewalls, but we've done a very poor job of managing firewalls. We are not conducting a review of the firewall system on a regular basis. For those of you that are on the webinar that are impacted by PCI, you know PCI requires you to review these firewall configurations every 6 months. But most have not reviewed the firewall configuration in 6+ years. So that's something that you got to take a look at, and I would highly recommend develop a firewall system policy for your organization. Antivirus is a requirement within the HIPAA rule, and you want to make sure that your antivirus capabilities are in fact current, they are actively running, capable of generating log files because you'll be referencing those if there are breaches or incidents. Audit control capabilities are very important. You've got to make sure you're generating the right log files, and there can be a lot of log information that's generated and it can overwhelm any organization. So two words are very important: consolidation, because you want to consolidate all the log files that are being generated across your systems and applications. And the second word, automation, because you don't have the human time to be looking at these log files. So you want to automate and define some events and thresholds that then generate alerts based on incidents that may have been discovered or detected. And the most important area of information security, especially as you think of HIPAA compliance, as you look to 2015, I think comes down to 3 words: encryption, encryption, encryption. And so encryption is an area that you've got to be looking at very seriously at. I would treat it as priority number 1, probably right after conducting a risk analysis activity, but you got to make sure that you're encrypting. I shared with you the statistics from the Forrester report earlier. Got to make sure your mobile devices are encrypted. Got to make sure all your transmissions with PHI are encrypted. We are seeing a lot of texting with PHI. That's got to be encrypted. So look at encryption very closely and very seriously within your organization. You got to articulate where you have PII, personally identifiable information, within your organization. And as I bring my presentation to a close, to give you a bird's eye view, you gotta treat security and HIPAA compliance as a life cycle. And that life cycle really comes down to 7 critical steps. Who is responsible for HIPAA compliance within your organization? You got to document that. That is a part of the HIPAA mandate. Step 2, risk analysis. Every organization should be looking to conduct a comprehensive risk analysis. It is a HIPAA requirement, the number 1 HIPAA requirement, as I mentioned earlier, and do that annually. Update your policies and your procedures and your disaster recovery plans or your contingency plans. Step 4 is the one that takes the longest time. Remediation is also the most expensive. Step 5, security of your third parties. That's where your business associates and your business associate agreements become so important. And I would highly recommend look very closely at your business associates. Make sure those agreements are up to date with the final rule updates. Every member of your workforce must be trained. All your employees, all your volunteers, all your contractors should be trained on the HIPAA regulation. So you've got to make sure you've got robust training that you're rolling out for them. And then evaluate all the deficiencies you discovered in step 2 of what you're looking at in terms of step 7 in terms of evaluation. So very important to look at HIPAA compliance, high-tech compliance, as a life cycle. Next steps: assign responsibilities and authority, conduct a risk analysis, conduct technical vulnerability assessments, develop an enterprise security plan. This should be a short document, 3 to 5, maybe 7 pages, that lays the priority for your HIPAA compliance and security program. Like I shared with you, that 2-column table, clearly document what controls you've implemented, what controls are missing in your environment. Review your business associates and ensure that they are complying, conduct training, and then evaluate. The bottom line: treat HIPAA and security compliance as a life cycle. I hope you're all as excited as I am today, and I wanted to leave you with a couple of things. Number one, EC First, just a very quick 10 seconds. We've served thousands of clients across all 50 states, and very humbled with our client experiences. We try to learn from our clients. We try to share to every client best practice that we see in the healthcare information security space, and we hope to partner with you in your efforts. We've also got certification training. These are the gold standards for HIPAA compliance training in the industry. So your certified HIPAA professional program coming up in Orlando towards the end of January. The world's first program that covers all of the major security regulations. I've been talking about those: ISO, PCI, HIPAA, HITECH, NIST, FISMA in the CSCS program. And that's also coming up in Orlando. We can also bring these classes. Konica Minolta, we're working with them to bring these classes to any Amerinet client. We can assist you in several areas as a result of the Amerinet Konica Minolta agreement. So this includes risk assessments. This includes development of your policies for HIPAA compliance, conducting vulnerability assessments, conducting training on at your site, delivering webinars that may be of relevance. And this is a very important URL for you. I wanted to just keep this on the screen for about 10 seconds. If you complete this, should not take you more than 10 or 15 seconds, but if you complete this form, very few questions here. We are sensitive to your time. We will send you out a copy of today's slide presentation, as well as some of the checklist documents that I've talked to you about, checklist for HIPAA compliance. So again, please visit ecfirst.biz and this URL and complete that form. We would be excited to send you the copy of the presentation slides, as well as additional documents I've referenced. And your point of contact for this event and all communication is one human being who gets very excited when he sees HIPAA information coming from you, Rick Kingsbury, and you can see his email address and his direct phone number. Call him, email him. You also see the URL there. That goes directly to Rick, and he will immediately respond with a copy of the PowerPoint as well as additional checklist documents that we shared with you. I also had one additional request. If you appreciated this webinar event that we brought to you, a reference or a testimonial about if you felt it was great would be absolutely appreciated. We are looking to bring such events to you on a regular cycle. The next one is going to be coming in February, and that is going to be focused on breach notification. So that's going to be coming up in February. So again, I want to leave you with this slide here. I want to thank all of you for being on this webinar today. And then Lorna, if you had anything you wanted to add as we bring this event to a close.
Well, thank you, Ali, for another wonderful presentation. We just appreciate the opportunity to partner with Konica Minolta and Amerinet, and Rick Kingsbury is a wonderful addition to our team to work with, and we look forward to talking with all of you in the future.
Thank you all very much. we are very, very excited to have shared this event with you. We've also recorded it, and Rick will get information to you if you'd like to have access to the recorded event. And like I said at the start of the presentation, control your excitement. Don't go too wild. Get HIPAA compliant. Thank you all.